Thank you, Madam Chair. And I'd like to start with Dr. Elsayed. You were telling us your opinion of the 2023 Pan-Canadian Action Plan on Antimicrobial Resistance. And you, I think, endorsed 5 pillars, but you were going to explain to us what you felt were some gaps. So perhaps you could take this time to elaborate a little bit on what you see as gaps in the plan.
Yes, thank you. Madam Chair, the way I would answer that is, so the gaps that exist right now are the expedited regulatory approval for new antimicrobials. This is urgently needed at the federal level. So the delay between the availability of newer antimicrobial agents in the US and Europe and their introduction to the Canadian market often exceeds 7 years if they become available at all. Many clinicians in my field rely on the Health Canada Special Access Program to secure access to some of these newer antibiotics. However, the process isn't feasible for managing life-threatening infections. For some medications, it might be next-day delivery, but for others, it might be 3 weeks. There are also shipping costs involved. So for some of the drugs, we have to sign a contract with the manufacturer, and that contract might involve shipping costs that are in the thousands. And again, a delay of 3 weeks would be unacceptable in this type of setting for a life-threatening infection. Only 1 of 6, so one of the other panelists commented that since 2010, 3 of I think 15 antimicrobials have been approved by Health Canada. In the last 10 years, only 1 of 6 that are designed specifically to target the critical priority pathogens according to the World Health Organization have been approved by Health Canada. There was one that was just approved in May or June of this year. But that's just one. There's like 5 or 6 other ones that we need access to, and we're going through the special access program. I don't think it's a problem with the special access process. It's just the actual delay. The other thing that needs to be done is there needs to be an online portal for the SAP program. Right now, we deal with phone calls, faxes, paper. It's very manually labor intensive, and I think that process needs to be improved so that we can speed up the process and make it more transparent. The other thing, well, there's 3 other things. The other thing that I wanted to highlight is the increased use of antimicrobials in domestic agricultural practices. Antibiotics are used as growth promoting products, and the use of antibiotics in animals obviously carries itself through to the food chain and then to humans and then to the environment. And so there should be some limits to the use of antibiotics in animal husbandry. As other panelists have mentioned, antimicrobial stewardship programs should be mandatory. Dr. Dhami commented that even though it's mandatory for acute care facilities, there's lots of variability. Some places I know don't really have a good antimicrobial stewardship program, even though they're supposed to have one. As I have in my speaker's notes, but ran out of time, the antimicrobial stewardship requirements in the US are different than in Canada. In the US, all long-term care facilities require the implementation of an antimicrobial stewardship program. In Canada, we don't have that. This is very, very critical because elderly people in nursing homes bear a large burden of antimicrobial resistance. And so practices that can help mitigate unnecessary use of antibiotics are essential in that setting. There needs to be increased funding for hospital infection control and antimicrobial stewardship programs. That's kind of related to what I already said. So those are the 4 main points: expedited regulatory approval of newer antimicrobials, increased restrictions in domestic agricultural practices, mandatory antimicrobial stewardship programs, going beyond the acute care facility. I also agree that they should be implemented in the community, as I believe Dr. Stinson mentioned, or one of the other panelists mentioned, and then increased funding for existing hospital infection control programs and antimicrobial stewardship programs. 75% of the burden of antimicrobial resistant infections occurs in hospitals. The other 25% occurs in the community. So really a focus on hospitals should be a priority by the government. So I appreciate the questions, and I hope the answers will stimulate further discussion. So.
Thank you so much. My microphone didn't go on. That was very, very helpful. Dr. Dhami, you made the comment related to the fact that there were only 3 of these newer antimicrobials available in Canada, even though worldwide there were some 18 or thereabouts available. Why is this? Perhaps what we've heard from some at the Science and Research Committee, some pharmaceutical companies are loath to even apply for use in Canada because the market is small and there isn't perhaps not the financial incentive to invest in the Canadian need in healthcare. So are you aware of what has happened in terms of access to these new antimicrobials in Canada?
Yeah, so what we do hear from our pharmaceutical industry colleagues is, unlike other drugs, antimicrobials are often prescribed for shorter or time-limited courses of treatment. We also know that while stewardship programs improve and optimize the use of antimicrobials, they can also have sort of that detrimental effect on limiting the growth potential of antimicrobials. And so
to wrap up, please, Dr. Dhami. We're well over time on this session, on this round.
Sure.
And you can elaborate in another when someone else asks your question. Thank you very much. I'm sorry about that.